3.
Hello, are you choking now? I can see you having difficulty breathing. Cough it up for me, cough it up. No, you're not coughing. I'll give you a couple of slaps on the back to try and free it for you. No, that hasn't shifted it. We'll have to use abdominal thrusts. Out in 1. Because I've done this, you need to go to hospital.
Okay, if someone comes to you or is presented to you when they're choking, first thing you do is you ask them, are you choking? Seems a stupid question, but if they're able to say yes around whatever's in their throat, then they're not actually choking. They've got an obstruction which may become a full choke later on, but for the minute they're not choking, so you don't need to progress to this level of treatment. Second thing you do is ask them to cough. Your instinct when you're choking is to gasp and to breathe in. You don't think about breathing out. So just the action of coughing can help to dislodge any blockage. That doesn't work. You need to give them 5 back slaps. So you need to balance their body with your arm. So bring your arm all the way around them as much as possible. Obviously this hasn't got arms on it, so it's going to be difficult to do. So you need to get as much support in front of them as possible, and then give them 5 firm back slaps. Now these need to hit in the middle of the shoulder blades in a slightly upward angle, and you don't need to be polite about it. Do it with some force. So that's not come out. So then you need to move on to abdominal thrusts. Now you need to get yourself behind them so that their body is as close to yours as possible, so that you don't have the extra gap to pull up to. You need to get your strongest hand, I'm right-handed, and put your thumb out in a fist like that, and then your hand needs to go between the rib cage and the belly button, about there, your weaker arm underneath, and you need to pull up and in. And then you continue, you start again with back slaps. Another 5, and then another 5 thrusts. If the blockage is not quite in the right place, this won't work. It may move it, so they may be able to get some air in, but you won't necessarily be able to clear it unless it's in exactly the right position. But you continue until either it's cleared or they become unresponsive because they can no longer breathe. So then you start with the CPR, which you should have seen in a previous video. So that is basically how you deal with choking. In terms of relative size, if you're dealing with a child, the back slaps are pretty much the same, but the abdominal thrust is 1 arm only for a child. Otherwise you could do a lot more damage than you intend. And if you've had to go to abdominal thrusts on anyone, adult, child, whatever, they must go to hospital. Because the action of thrusting in and up, you've basically moved about all their internal organs. So you could well have caused some bleeding. So make sure they go to hospital just to get checked out on the off chance. So that is how to deal with a choke. Right, so we've done adult and child choking, but when it comes to baby there are some slight differences. Obviously with a baby they're more likely to be drinking or to be eating liquids, not solids, unless their older brother has tried to feed them Lego or something like that. So in terms of sorting out a baby that's choking, if you've got a long enough arm to do it, lay them along your arm, support their head with your hand, and kind of angle them downwards slightly, so that anything liquid may well come out on its own. You can encourage it with 5, not back slaps on a baby necessarily, they're kind of back taps, kind of encourage things to move. That hasn't cleared it. For a baby it's similar to what you do for an adult. So after you've done your back slap, or your back tap slaps, whatever you want to call them, place them onto some solid surface And there's nothing to do around the abdomen because you can do a lot of damage if you try and put any kind of pressure down here. So you come to the chest between the nipples, 2 fingers on the breastbone, and 5 chest thrusts could possibly help to force out whatever's stuck in there. If you can do a couple of cycles of this, but by that point they're probably going to collapse. So then you need to move on to resuscitation, which I showed you before. Starting with the ABCs, or Dr. ABC, the danger you're looking for in particular here is probably going to be the parents. If you are not a parent, then they are going to be panicking about what's going on. So if you've got someone with you, let them deal with the parent or send the parent off to make the phone call. Either or, you might want to distract the parent from the situation. So that's your main danger, really. So response, you're looking for a response from the baby. Obviously they're not going to answer you if you call their name. They're not going to respond if you ask them to do something. So you need to get some sort of physical response from them. So you can yell, make a loud noise, that might work, or tap them on the feet, just to see if there is kind of an instinctual reaction. Small babies claw their toes. When they get older, they unclaw. But if you get some sort of reaction there, they're at least alive. And the same with an adult, or child. You want to listen for breathing, so you're not tipping the head back, bringing it face down, close to the baby, so that you can hear any noises coming in and out of the mouth. And you're looking across the chest. Babies' chests don't tend to move that much, but their bellies do. Because there's so much stuff in here, they use a lot of that to breathe with. So if you're looking across their body, you can see that moving, they're breathing, they're fine. If they're unconscious, you want to put them into a baby's recovery position, which is ideally along your arm, slightly downwards facing in case anything comes up. So that the gravity is carrying that down and you're supporting them completely. If your arm isn't long enough to support them that way, so you can support the body with one arm and the head with the other. Always support the baby's head. Right, so a non-breathing baby. So you want to put some air in because with a young baby, under a year old, it is more likely to be a lung problem than it is a heart problem. And an adult, it tends to be the heart that's the issue. So for a baby, you're going to be sealing all the way around. There's no way you can get a pinch on the nose or anything like that on a baby and do it realistically. So you need to get your mouth all the way around, mouth and nose, and you're not blowing up a balloon, you're not forcing the air in. If you put too much force behind it, you can damage the lungs and also fill the stomach. So then you've got more issue of lung damage and then bringing up whatever's in their stomach. So for a baby, it's 5 breaths initially, and it's at that speed, that amount of force. And then compressions are middle of the chest, so between the nipples, 2 fingers, and it's 30 of those. And then 2 breaths, 32, until they start to move and recover, or an ambulance crew comes and tells you to stop. In terms of compression depth, you're going about 1/3 of the way down. Now babies range in size massively, so I can't give you a numbered distance, but it's just 1/3 of the way down. So that is how to do CPR on an infant.